Public health is a population-based field of science focused on preventing disease and promoting health. Every week, we will be engaging in interactive discussions and analyses of the latest public health issues affecting you and your communities all around the world. This is the Public Health Insight Podcast.
Hello everyone, my name is Ben and I'm here with Linda, Gordon, and LaShawn. Before we move on, it is important to note that the views expressed in this podcast are our own and do not represent any of the organizations we work for or are affiliated with. November is Fall Prevention Month in Canada. Having an entire month dedicated to raising awareness about the incident of falls, the associated risk factors, and the urgency to support healthy aging is an indicator of the magnitude of this public health issue. In this episode, we'll be using the article, Preventing Senior Falls Requires Community Approach, written by Kim Chrisberg in a publication of the American Public Health Association, as a foundation to discuss why is fall prevention a public health issue. At face value, a fall is such a common life occurrence that at first we may not appreciate its impact versus describing a heart attack. But as we'll learn and discuss, its burden on public health and the healthcare system is quite distressing. So let's begin our discussion by defining what a fall exactly is.
All right, so according to the WHO, the definition of a fall is as follows. A fall is defined as an event which results in a person coming to rest inadvertently on the ground, floor, or other lower level. And fall-related injuries may be fatal or non-fatal, but most of the time, they're non-fatal.
Yeah, and according to the International Classification of Disease, ICD, they define falls as injury resulting from falling, including falling on the same level, which includes something like falling on a sidewalk, falling from one level to another, which stairs are an example, and falling from an object such as, some furniture, whether it's wheelchair or couch or off the toilet.
So what causes falls?
Well, the first thing I think of is weather. So, in Canada, our winters can get pretty hectic. So, if it's an icy sidewalk or something like that, that's a huge factor for falls for all age groups.
Mm-hmm. That's typically the first thing that comes to people's mind. But if you look at it in the grand scheme of things, falling from walking on a surface such as, snow or ice only accounts for about 15 to 16% of fall-related injuries. And falling from walking on just a normal surface actually accounts for about half of all falls that result in injuries.
Yeah, so when I kind of reflect on some, instances of falling, I think about areas in my life where I spend the most time. So for me, one of those examples would be at home. So what are the different, hurdles or objects in the house that contribute to fall? So can it be a carpet that doesn't have grip? Can it be in your washroom where there's wet spots that it could allow you to slip more easily?
Getting into the bathtub, maybe slippery bathtub, maybe even you're wearing the socks and, the friction between the floor and the sock is not very strong. So you kind of fall and stuff like that.
Yeah. And even just going back to that stairs example, you were talking about making sure you have handrails on your stairs or any other areas. Did you fall down?
Have you ever fallen up the stairs? You ever fall up the stairs? Going up and
I have. Honestly, when I saw that was one type of fall, I didn't really get it. How could you fall up but I guess you're going up the stairs and you fell.
Try it,
You kind of miss your step going up, so you kind of just
it counts as a definition.
Makes sense.
Yeah, that too. Imagine even wearing socks going up the stairs. You're running quickly up the stairs. Boom. You just fall down.
Yeah.
It happened to me a bunch of times.
Yeah, exactly. But also one of the reasons someone can fall too, which is, let's give a more kid-friendly example. Kids are very curious, engage in, certain behaviors such as playing sport outside and doing all kinds of crazy stuff. So that's one of the common reasons as well that people can fall, is just engaging in physical activity.
Right.
Yeah, and I guess even going on off of that, if you're thinking of kids indoors as well, a lot of parents put up some child gates by the stairs so that children don't fall down. So that's another important thing.
And my sister has done flicks off a chair and fallen as well, which was scary, but That's just what, when you take your eye off a kid for a minute, that's kind of what happens, right? So,
Yeah, it's like they can tell that they're not being watched and they just start doing crazy stuff.
Or even just harmless things like being on a bed or something. A kid could
that is
easily
true.
roll over
Exactly.
and fall.
Yeah,
So.
just jumping on the bed's fun, you know?
Is that from current experience or?
No, back in the day, man. Back in the day.
So we talked a lot about like external reasons. What about internal reasons as the causes for falls? So if someone has like a medical event or health problem, because that kind of segues into our target population as to why falls is a public health issue.
Right. Yeah, I'm glad you brought that up, because about 8% of falls result from some kind of medical event or health problem, of which there's like a pre-existing or underlying cause, like, you know, seizures or stroke.
So even developmental issues like cerebral palsy, you're just at risk for falls. And it's hard to mitigate that because it's not something like aging that caused it. It's just something that carries with you. So
yeah, I guess other kind of internal factors would be if you have issues with maintaining your blood pressure or managing your blood pressure, dizziness, if you have a stroke or if you had a stroke in the past, and even like we talked about in our last episode, dementia.
Also, if you have an impairment with your vision, that could contribute to falls as well.
With depth perception and everything, yep. So I know LaShawn mentioned this, but how falls primarily occur at home. But are there any other settings where falls also occur that result in emergency department visits or hospitalizations?
Yeah, I guess long-term care homes, which is a little scary because intuitively you would think this is the safest place, a long-term care home, but a lot of falls can occur in those settings because the population is at risk already.
Yeah, and if you think of just, you know, the resources that are needed for around-the-clock supervision, you know, in these institutions, they're not chained to their bed. If you think of an example with people with complex needs like dementia care, if they get up in the middle of the night and they're not sure where they are, they might get a little flustered and, you know, lose their balance and stuff like that.
That makes me so sad.
Yeah.
That's so sad. Yeah.
Yes.
Oh yeah. No, yeah, of course. Like even relating back to some personal examples, my grandma who lives with me, she has dementia and, you know, she gets up all the time at night to go to the bathroom. And, you know, what we've done is we have night lights across the house so that she'll be able to navigate a bit easier during night when there's limited light.
Yeah. And to that point too, LaShawn, a key thing too, like on one end of it, you have chronic medical conditions that in of themselves increase the risk of a fall event, and you have medications that you take to treat those conditions that also can increase the risk of falling. So if you think of a lot of times seniors take medications such as laxatives to go to the washroom, or even diuretics for, you know, blood pressure reasons, and this increases the frequency by which they need to access the washroom, which includes getting up and down from off the sofa or the bed more often, which increases the exposure and risk of potentially having a fall event as well. So
thank you for laying that out too, to see how all these factors are connected and contribute to falls.
And then because we have a lot of factors that contribute to falls, there's also a lot of outcomes that come from falls. So, you know, you would think, oh, a person falls down, they get physically injured. But in reality, it's a lot more nuanced than that. Right. So, for example, if we just talk about the physical aspect, they would get injuries such as hip fractures, spinal injuries such as herniated discs, head injuries such as concussions. But in reality, there's more going along with the psychosocial aspect of falls.
Yeah, so I think one thing from doing my research on falls in my work at the health unit, one of the things that came up is fear of falls. So when someone, and we're talking about in this case older adults, because children seem to have no fear, so it's that's something that doesn't deter them from engaging in future behavior. But seniors are actually pretty anxious about falling. So especially if they had a previous event of a fall. So this affects their willingness to want to go out and put themselves, you know, maybe they used to walk before the fall and they fell on the sidewalk and now they're a little bit scared that it happens again because of all the trauma associated with it. You know, they lose their independence essentially, and they lose the kind of their freedom if they experience a fall.
Absolutely. And even to go off that again, like you're thinking about an individual who maybe has had a fall, and then they're more fearful to engage in activities like walking, jogging, running. But then again, that kind of is almost a negative feedback if you stop participating in exercise, because we know the importance of exercise and building muscle and maintaining muscle mass and balance. and how that's important in preventing falls as well.
And I think that the key piece here too is, so on one end of the spectrum, you can fall, get a little bruise or a scrape. Maybe you just have a scar on your skin and there's no kind of long lasting effects from it. And then if your falls are severe enough, you might need to go to the emergency department, and you might even need to be hospitalized. And we know that falls are the leading cause of injury related hospitalizations for older adults. So we can see like what Ben alluded to, falls is a very complex issue, and the set of outcomes are very diverse as well, ranging from kind of the less severe to more severe, and even a lot of cases people die from a fall. So that's very important.
I wanted to talk more about the population health burden, because we talked a lot about the personal aspects of a fall and how they can burden the individual who has fallen and also the family. So falls are the second leading cause of unintentional injuries for deaths worldwide. And it's second only to road traffic incidents, which we discussed in a previous episode. So why hasn't this gotten more of a focus in the past?
Yeah, I think this kind of ties back to the episodes we did on dementia, because it's seen as something that's a part of the natural aging process where people lose muscle tone, they lose bone mass, they lose their balance, they become older and frailer. It's just like, it's expected that grandma's gonna fall, right? So there's less of a need or urgency to kind of look at it as something that's preventable. And that's kind of the reason why, for all the episodes we've been doing on injury prevention, we've stayed away from the word accident, because accidents suggest that something was kind of inevitable and not preventable, that the ice on the floor. So if we go back to even the ice on the floor, I give you a personal example. I had a very bad fall during our MPH program, where I was actually running to catch the bus to get to class, because our classes were mandatory, and I was running and it was icy everywhere because I missed the bus. So I had to run like 1 kilometer in 10 minutes on ice to catch the bus. And that's a recipe for disaster. So I was like running and I was turning a corner. There's an ice sheet there, and I just right? So was that preventable? Absolutely. Would it have meant that I missed the first part of class? Yes. But was it preventable if I didn't run? Absolutely. So I think we have to, it's one of the reasons we're kind of peeling back falls to the basic level. Like, what are the causes of falls, to kind of see, maybe if you didn't have clutter on your stairs, you wouldn't have fallen. Maybe if my socks feels a bit slippery, I don't think it's safe to walk. Maybe you took off the socks or wear house slippers with more grip. So stuff like that helps reframing the argument to make falls something that's more preventable.
It reminds me of the road traffic incident episode as well, where we discussed how that idea that road traffic incidents are inevitable versus preventable. So I would love to see that same kind of, I guess, energy towards the vision zero in terms of road traffic incidents to vision zero in terms of falls. That'd be really cool. So every year there are 37.3 million falls that are severe enough to require medical attention. So we know that this is a common issue and we need to do something about it.
Yeah, so each year we know that globally there are about almost 40 million falls that are severe enough to warrant some kind of medical attention in the shape of an emergency department visit, hospitalization, or some kind of medical care. And of those falls, we know that results in about 17 million disability adjusted life years lost. So in the context of disability adjusted life years, aka DALYs, is there a nuance of calculating DALYs in this situation? Because we know that from our previous discussion, children and older adults are disproportionately affected. So when we think of something like DALYs, that includes a key component of premature years of life lost. It's important to tease out DALYs have a weighted portion where it accounts for the premature years of life lost. And if children are dying, that's going to skew disability adjusted life years lost in terms of being more, because the life expectancy for children is obviously higher than someone who is 65 plus. So essentially, the whole point of this is, following a fall, seniors are more likely to suffer a notable injury, right? Yep. And then they're less likely to recover to their pre-fall state as a result of any acquired permanent partial or permanent total disability. And as a result of this, they're more likely to kind of lose their dependence than the younger population under the age of 65. So that's all that we're trying to say here. Yeah.
So are the risk factors the same for both populations?
So I think the risk factors are similar when we talk about it, looking at falls from a social determinant of health perspective. We know that, in the context of falls, income will be important. We know that work environments will be important because if you have a more hazardous job, maybe you work in construction, you have to go on high-rise buildings, there's an increased risk of falling. We know that, housing conditions are a risk factor, and income, poverty are also risk factors for fall. So this is where, regardless of the population, these would kind of be prevalent throughout.
Okay, so from an environmental aspect, in terms of social determinants, there's some similar risk factors. But I would disagree when you zoom in on each age demographic, because in terms of older adults, I think a lot of falls perhaps are due to having limited mobility and not being able to be as active. Versus in children, your risk increases when you are that kid that's climbing on everything, and you are more active. That can increase your risk of falls. So I would say they have different risk factors for the age groups.
Further to that, Linda, when you look at things like chronic conditions that are more related to aging, something like, like you mentioned mobility, but we can also throw cognition, vision, and hearing impairments to that. That's more likely to disproportionately affect older adults. And those are also risk factors for falling. So these suggests that there are both similarities and differences for the different groups that are affected by falls.
Now, does gender play a factor at all?
Based on some of the research that's out there, it's been shown that across all age groups and regions, both genders are at risk for falls. In some countries, however, it's been noted that males are more likely to die from a fall, whereas females suffer more from non-fatal falls.
Yeah, that's interesting. I wonder what the reasons are behind that.
I wonder if it has more to do with the occupational roles and gender roles, and also just the amount of risk. I mean, for example, males typically tend to be the ones doing more, for example, construction work. And if you have a fall there, your risk of death perhaps is higher, as opposed to if you're a female and you fall in your home. So that could influence it, but definitely would love to see the data on that.
Yeah, it just kind of goes to show falls are complex. They affect everyone. And, there's data out there showing that a huge percent of falls don't even have a single cause. It's multifactorial.
And I think that's a great segue into the way that different countries approach falls. So each year, an estimated roughly 500,000 people die from falls globally. And over 80% of those falls occur in low to middle income countries. And with the regions of the Western Pacific and the Southeast Asia accounting for 60% of these deaths. So why is there a difference in how countries view falls? And is that affecting the data that we're having? Because as we said, it's multifactorial, but we have some data suggesting that men are more likely to have fatal falls, some data that says maybe that might not be the case. So is there something that we can tease out here?
We had a very great discussion in one of our previous episodes on dementia about the disproportionate burden in low and middle income countries. And that was kind of tied into more of a lag in the increase in life expectancy. I'm guessing it could be a similar case here where the percentage of the population that are considered older adults are increasing more rapidly in developing countries as they kind of move from developing to developed countries as their economies begin to flourish, and diffusion of innovation such as medical care and treatment kind of trickle down to developing countries and the life expectancy goes up. That might be a reason why there's that disparity between global incomes. But 80%, that seems a little bit that's a very interesting number,
right?
Yeah, and it could also be just based on like the infrastructure, so built environment. So are there safe areas for walking throughout the areas in low and middle income countries compared to developed countries, which may have a more regulated sidewalk or roadways or pathways that you can walk and do exercise and engage in different activities?
Or even are there handrails in common areas? Like, these are things that we take for granted, when in reality they're everywhere. And
it kind of brings me back to the road traffic episode, where it's like, how come even though it's such a huge burden of death worldwide, how come it hasn't got its shine? Maybe it's because there are other pressing issues in low and middle income countries that, are prioritized ahead of looking at falls.
Right. And if it's conceptualized as something that's inevitable, why would you spend limited resources to address it?
Yeah.
Well, I guess, I think one key thing that we didn't really touch on is, like, I'm looking at it again, over 80% of fall related fatalities occur in low and middle income countries. And we talked about a lot of these fall related injuries require emergency department visits and hospitalizations. But we've, as we touched on in previous episodes, there is a gap in the healthcare system structures that exists in a lot of developing or low and middle income countries. So if people aren't able to get the care that they need following a fall related event, their risk of dying will be greater compared to countries like Canada, where there's universal access to healthcare, where you would never necessarily, unless, I acknowledge that there are rural regions where access is difficult, but in general, most people aren't worried about not being able to get an ambulance to get to the hospital. So I imagine that could be the case for why more people die. It would be interesting to see the incidence rate of falls like that don't result in deaths, to see if that's different, because that would tell us that it's more the care aspect that is kind of causing this disparity.
Right. And even as we know, funds are usually reallocated to acute trauma care. So if there's minimal public education being addressing injury prevention, that kind of helps with the whole, we're focused on building up our healthcare first versus public health, like the preventative measures. And also that may tie into the general attitude that lawmakers or policymakers have, where they believe that injuries are the result of bad luck, right?
Yeah, I'm wondering too, do you think there'd probably be some cultural differences too for the way people approach falls? Like, I know in the Western culture, it's more, and Linda touched on this in our dementia episode, it's more acceptable to kind of put your parents in long-term care homes. But in the kind of more Eastern cultures, it's usually the children that look after their aging parents. So is it their needs are not being met in the home setting, considering that most falls occur in the home rather than the long-term care settings? I don't know. Curious. But
I mean, that's something worth exploring, because if you think about it, how do you modify your home to meet the needs of an elderly person? It's expensive. That's not something everyone has access to. So that definitely could be a factor.
Or just know how to do, right?
Yeah.
Right.
Or do you have the space to do it? The resources. Right. Like, even personally, my mother already has trouble going up and down the stairs, and she's on the second floor. So in the future, I'm already thinking like, okay, what room do we have downstairs, or what space do we have downstairs to restructure as like a living space?
And it's difficult because you got to consider the functional aspects too, right? So what kind of modifications you make in the kitchen are going to be different from the ones you make in the bedroom, and that's going to be different compared to the ones you make in the bathroom. So there's a lot of consideration and different kind of materials and tools you can incorporate for that. And a lot of people don't know what's out there.
Yeah, before we move on as well, we kind of touched on it earlier. There are underlying social determinants of health that kind of influence a population's risk of falling, and income is one of them. So if the financial resources are not available, whether it's in a high income country and then you have like lower income neighborhoods, or if you're looking at it from a global perspective where you're talking about low and middle income countries, some of these communities and families might not have those resources available to do some of those best practices in home modifications to support the complex needs of the aging family member. So that's kind of a reason as well.
Absolutely. Like, just going off that even more, just like thinking about even getting vision care, that in many countries, it's not a part of their universal care, or considering footwear, nutrition. So a bunch of social determinants of health play a factor as well.
That was a great discussion regarding the risk factors for falls, the risk population, the population burden. So in our next episode, I wanted to discuss what are the interventions to help with fall prevention, and what are some case studies that we can use to discuss it.
Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our content and would like to stay up to date, follow us on Instagram, Facebook, Twitter, and LinkedIn. To learn more about our community initiatives and how you can support us, visit our website at thepublichealthinsight.com. Join the PHI community, and let's make public health viral.